With the injections, yes, it is a series of injections, a minimum of 4, maximum of 7. It's given on a weekly basis. But the nice part about it is that you don't have to take time off of work. You're not necessarily slowed down. A couple patients have said that after the injection they've had more pain for a couple days and then it ends up subsiding. But usually that increase in pain doesn't return with subsequent injections. And you also aren't worried about wound issues or developing collection of blood as if you would have if you remove the nerve. If you remove the nerve, you're generally 10 to 14 days in a special surgical shoe. Off of work, you run the risk of an infection, non-healing of the skin. Sometimes you get a collection of blood between the two bones where the nerve used to be. So I usually use the alcohol injections as kind of a stopgap before you have to get to surgery. It's about 70% effective, so it does work pretty well. Fractures are generally caused by trauma. There's 2 different kinds. One of them that is shifted out of place. One of them that is normal, so all you do is need to cast it. There's a third part where if you have break a bone and it comes through the skin, that's a totally different separate issue that needs to be addressed right away with surgery. If the break is displaced or shifted out of place, you need to go in surgically and realign it and restore it. If it's not out of place, putting them in a cast usually will do it. Typical healing time is 4 to 8 weeks. Kids heal closer to 4 weeks. Most adults, I usually just tell them it's 8 weeks of healing time. And it can be prolonged if you have diabetes. If you have long-term steroid use, steroids can even cause the breaks to happen because it weakens the bone, and therefore it'll make it even harder for them to heal up later on. Poor blood supply, there are certain bones within the foot that are notorious for taking a long time to heal, and as long as you know that ahead of time, I usually just put the patient in a bone stimulator, and that usually does help them out. They still takes a while for it to heal, but it speeds up along the healing process. It might cut it down from 6 months, might cut it down to like 4 months. So, and here is a fracture. You can see here, this is your ankle, outside part and the inside part of your ankle. Little mountaintop over here. And then also over here, this is a break that is in good position, good alignment, no surgery, put them in a cast, and you usually heal up pretty well. Sorry about the old picture, but this is a fragment out on the side view. This fragment here should actually be sitting down over here. So this is one that not only has shifted back, but it's also shifted up. So you have to go in there and put it back down, put a screw in, and then also you put a plate in to hold everything in place so it doesn't rotate out of position again. Stress fractures are also pretty common. It usually happens with wear and tear over time. Very common to happen if, for example, if you change jobs, if you used to have a desk job, enter data, things like that, and then you go and you decide to either do a waitress, start working in the trade, somewhere in your fleet all day. This is something that will happen over time. It's not going to happen usually during the first week of work, but it happens a month, 2 months, 3 months later on after you've been doing this for a long time. Or January 1st comes by, everyone's like, okay, New Year's resolution, I'm going to get in shape. And when they were 10 years ago, they were in high school or wherever, they used to run 3-4 miles, and they're like, I'm going to get back into it 3-4 miles day one. And so you can develop a fracture from doing that. It's just overuse. They don't always show up on an x-ray. If I'm suspicious of it, but it doesn't show up on an x-ray, I'm going to treat you anyways as if it was, and I'll see you back 2 weeks later for a new x-ray. If you've had this pain for a long time, 3-4 months, and x-rays are normal, I will go ahead and I will just get the MRI. MRI is extremely sensitive in terms of picking up a stress fracture. It might not pick up, it might say that the bone itself is not broken, but you do have swelling within the bone, which is an indication that, yes, there's something going on, but it's not enough to show up on an x-ray or to actually break the bone. If you do have a stress fracture and you blow it off, you can actually break it. This is a patient who she long-term steroid use, walking around. She has a job anyways where she's on her feet all day, had some swelling, redness on her foot, had pain right here, right up along the bone over here. This case, it looked really good. There's no break within it. I treated her, put her in a surgical shoe, saw her back 2 weeks later, and here's her bone broken here. It's not shifted enough to where she needs surgery, but it's shifted enough to, yes, the break is very obvious. And then this is her final result. What your body does to stabilize it, it creates this extra bone in and around the fracture, and this will end up remodeling. You will always have a knob of bone here, but the bone's going to be solid and pain-free. That's it. Now, any questions?
Are those your children?
Yes, they are. Yep. So my daughter is 9, and the 2 boys are 7.
Daddy, did you show us at the meeting? They'll ask you.
Is what?
They'll ask you if you showed them?
Yeah. Well, they already saw this presentation at home, so they know they're in it. Yes.
Swelling of the bone. I didn't know bones swell.
Yeah, it can happen either from something that falls on it, or more of what's called a bone contusion, and it's just swelling within the bone. A lot of times it doesn't show up on X-ray. It can be painful. A lot of times the symptoms mimic the same thing as a stress fracture, even a regular fracture. So if there's any question, I usually will send you out for an MRI. A lot of them come back that yes, they are positive for swelling, and that point is I know that that's what I'm treating you for, and I'll keep you in a boot or a walking boot or a shoe until your symptoms improve from that point. Rarely do I need a second MRI to prove that okay, it's healed up. I basically go by the symptoms.
I had bunions, and I had my bunion fixed 3 years ago,
Mm-hmm.
and I had my second toe, which was a hammer toe, fixed, and now it's not laying flat at all.
Okay.
And so the big toe is kind of going under.
Kind of going under there, yeah. So
what do you do with that? Are the spacers going to help?
the spacers will help keep the 2 toes apart. A spacer is not going to help to bring the second toe down.
Yeah.
A lot of times when you do approach a hammer toe, you approach from the top, so you can have some scar tissue up at the top. Sometimes sent into for physical therapy for mobilization where they just pull the toe down. That's one thing. The other thing is to get the tendons working again. One of the exercises is to try and grab a towel and try and bring it towards you. That forces the toe to come down. The fact it's been 3 years, it's worth a shot, but I don't know how much that would help. The other thing you can always do is you can release some of the tendons and the ligaments here up at the top of the foot, bring the toe down and pin it in a down position. It's not going to guarantee that it's not going to sit down again, but it's always possible that the toe might float back up.
Well, when the doctor did the surgery, he said, I can't guarantee anything.
Okay.
So,
Yeah.
I'm kind of left holding the bag. I just kind of push it down every time I sit without my shoes on.
Okay. Yeah, because the other thing sometimes I do is I have a patient tape it, just that toe. They'll start on the bottom, tape it across the top, and then bring it back down. So you end up taping it a down position. But it sits well while it's taped, but once you take the tape off, the toe a lot of times will drift up. I would not recommend taping it during the night while you're sleeping. It would be more advantageous to tape it while you're up moving around during the day.
Okay.
Yes?
Regarding the pain that starts at the joint of the big toe and goes up to the nail.
Okay.
And it's a shooting pain, and it usually lasts for about 24 hours and then gradually subsides.
Okay. How often does that happen?
Maybe a couple times a year
Couple-
to each one of the toes.
To each one of
the big toes.
Okay. Now, have you had a history of gout?
No.
No.
I've
Okay.
had multiple surgeries, however.
Of the feet or in those
Yeah,
joints?
No, of the feet.
Of the
And in
feet.
yeah,
So,
artificial joint and the...
okay. So it can be related from the surgery itself, whether it's scar tissue pitching up against the nerve. It can be weather related, can be activity related. How long ago were the surgeries?
Oh, they started 16 years ago. The last one was about 3 years ago.
Okay. So it's probably what you have is what you have. Going in there again and trying to bring stuff up, you might end up scarring the nerve in again. So you might end up with the same thing all over again.
Yeah.
So yes.
What kind of shoes do you recommend to keep your, athletic shoes?
Athletic shoes, there's a number of different good shoes. New Balance is a very good shoe. Asics is a good shoe. Saucony is a good shoe. Now, it also depends on your activity level. They make a walking shoe, a running shoe, a cross-training shoe. So, for what specific activity?
Just for walking.
Just regular. I would probably just do either walking shoe or a cross-trainer type of shoe. So, any of those are good. But also, kind of a asterisk to that is if they don't fit you while you're in the store, don't buy them. Even though I recommended them, if they don't fit your foot, don't buy